Good evening, ladies and gentlemen. Thank you so much for taking the time to be here with us on this beautiful spring evening. My name is Aram Sirakian. I am one of the co-founders of the Armenian International Dental Association, which was launched during the Armenian Medical International Conference right here in Boston in 1995 with the leadership of Dr. Zahir Uzunian of Toronto, Ontario. For the past 30 years, through various NGOs, our organization has been active in Armenia and Artsakh with the mission of educating, treating, and improving oral health in our homeland. Over the years, we have had events introducing our work in Paris, Lyon, Toronto, Montreal, Rio de Janeiro. Yet, despite having the largest number of board members right here in Boston, we have never held an event like this in our own city until tonight. The purpose of this evening is to introduce to you, our friends and family, to the newest chapter of our mission, the Oral Health Foundation for Children of Armenia, or OHFAR. We look forward to sharing with you the accomplishments we have had in the past, the work we're doing in the present, and the exciting vision for the future. We hope to gain your support and as we continue to strive towards our ultimate goal, healthy smiles for every child and every Armenian in our nation. Oral diseases affect an estimated 3.5 billion people worldwide, yet vast majority of them are entirely preventable. To raise global awareness about prevention and control of oral diseases, the FDI, World Dental Federation, has designated March 20th as World Oral Health Day, which is now observed annually around the world. Our goal is to bring this campaign across Armenia, and we began with our first stop at the Akner Village School in Syunik. We called it Zhipitor, which literally translates into Smile Day. And on the morning of March 20th, the students of the school surprised us with their enthusiasm and the song that written especially for this occasion, which was the video that you just saw. The theme of the campaign of the FBI is currently Happy Mouths, Happy Lives. Unfortunately, the situation in Armenia is not so happy, with nearly 90% of the children suffering from untreated tooth decay in their primary teeth. In 2014, our group did a study in Artsakh and found an alarmingly high prevalence of dental caries or tooth decay. A similar study was conducted in Armenia with comparable studies. This is what we typically see in a 6-year-old child in Armenia. One of the reasons is that our Armenian children love sweets. But oral disease has far-reaching consequences that go far beyond the mouth, affecting nutrition, education, self-esteem, overall health, and even national productivity. Armenia also has a very low density of dentists compared to other countries. The challenge is compounded by outdated equipment and uneven distribution of dental practices, most of which are concentrated in the capital city of Yerevan. In Armenia, there's no national oral health policy, no national oral health data, and there are no national oral health campaigns. We formed the Oral Health Foundation for Children of Armenia with the goal of helping implement all of the above. Our acronym is OHFAR, and our logo represents a smile in the shape of Mount Ararat. OHFAR was officially registered in Armenia in 2024 and represents a continuation of the work we carried out in Artsakh for the last 20 years under the NGO of Hand in Hand. And with that, I would like to invite my friend Dr. Berj Kilajian to share the story of our journey over the last several decades. Berj, one of the founding members of the Armenian International American Dental Association, has played a vital leadership role, serving both as president of IDA and now as co-president of OHFAR. He single-handedly recruited most, if not all, of our board members who are currently serving and making significant, meaningful contributions to our organization. Berj.
Thank you. So Armenian International Dental Association, IDA, was formed and launched in 1995 at the AMIC conference in Boston. So it was launched in Boston, the same as the Armenian Dental Association was also launched in Boston. And it became an umbrella organization of several other organizations in different parts of the world. California, Toronto, Montreal, Lebanon, Lyon, and France. So they all had a little Armenian dental organization. Some of them had dental organization embedded in the medical associations, but we all kind of start to work together and start figuring out how we can help Armenia at that time. So when we first formed IDA as an umbrella organization, we started by doing dental medical missions, like you hear a lot of people, they go for a week or two, and then just a bunch of dentists, and you just treat some patients as much as you can. We started like that for the first couple of years, and then many of the colleagues from all over the country, they came there. It soon came to realize that this is really not helping. It helps a little bit, it's not even a drop in the bucket. So I think there's no way, if we're going to make a difference, we have to have a bigger presence, and we have to have a clinic which is staffed by local dentists and assistants and stuff, so we can have a continual care over the year. And then at that time, Artsakh came, and Artsakh was kind of literally the worst part of Armenia, so to speak. And so we decided to concentrate the effort in Artsakh. So we opened our first dental clinic in Shushi. And then followed after that, we opened in Hadrut, and then Mardaget and Marduni. So over the 10 years, we opened about 4 clinics. And then we decided to also, we say, well, how about a mobile clinic? So you can take us to the villages outside the main centers. So we will send the mobile to have to serve the villages, and then we refer the major work and patient to actually to our clinic in the area. And then so few years after that, I also realized that it's not enough, because there is so much decay, there is so much bad dental health. It takes a long time to be able to make an impact. So I figured that the best way to make an impact is start treating children. If we clear the foundation, if we really build a solid foundation, that's how we can build the country. Otherwise, it was very hard to do it. You need a huge, immense of work, and it's people to do it. It's just not enough. I mean, imagine you're going to an adult who's going to have a crown or a root canal, you spend 4 hours and 5 hours in a dental chair. We can see 10, 12 kids and do a lot of other preventive dentistry. We can do a lot of work. So 2014, I said there's no more the adult. It was turned all to pediatric dental clinics. That's when actually I have my good friend, Dr. Arnie Weiss, who's a pediatrician from Boston. He started coming with me. So he's been coming there for 18 years. Sorry. Anyway, so we focused on children, and it started to pay off. Because once you start doing preventive dentistry, you start doing sealants and doing this, you start seeing great results. And we saw incredible amount of results. I mean, I have data, incredible data. And then we came up some other ideas. So where one of the board members of us she's from Brazil, they had their what we call brushadromes. So they had rooms which sinks and brushes, so the kids can go and brush their teeth every day. So we created some of those. We opened many of those in many of the schools. So the kids in the morning, they go supervise. They all have their toothbrushes. They have toothpaste. They learn how to brush everything. And they're learning this. They will teach their parents. See, the issue was not only the kids. The big issue is the parents. Parents are not educated in dental health. Parents are not educated. And actually, most of the parents there, you ask them, they say, well, why am I doing? Why the kids? He's going to change his teeth. Those are baby teeth. They're going to fall. So that's why when he was showing the picture before, 6 years old, 7 years old, with a tremendous amount of thing, because the parents are, oh no, he's going to have new teeth. He doesn't know that the foundation is this. Once you have the permanent teeth, you're going to have much worse going on because you have not built a real foundation. You have no way of cleaning. You don't know how to oral hygiene. You don't have any. So we were not only teaching the kids, we were teaching the parents and teaching the families. So the kids will go home, they'll start teaching their family how to brush, how to clean, how to do this. So that was one of the things, the brushadrome. And then a colleague of ours also on the board is in Toronto. He had an initiative that they were outside Toronto, they call it Brushamania, where they have one day a year where most of the kids in the schools, they go there, they all have a toothbrush and toothpaste donated to them, and they will start learning dental hygiene and doing the thing. And actually there is even more sophisticated and we started doing the same thing in Haraba, in many of the main schools. And then the kids, they will have also incentive, so they have a booklet. If the parent says how many times you brush your teeth, then you can get a little gift, or you can this. So it's just try to do anything we can do to try to just increase the awareness of oral health and dental health. So that's a bunch of work is there. We used to do like 10,000 children, and we will get the IDA, Ministry of Health, Ministry of Education, all things in one day, and they would all go somewhere, and it's televised so the people can see. So just creating an awareness in the population. So achievements in Artsakh, we did have 160,000 plus visits, 10,000 smiling children. And then, as you know, the operation starts. So 2020, when the first Artsakh war happened, say they took, Azerbaijan took sushi. And then the funny but not funny story is that when they took sushi, 3 months later, there was a video, a YouTube video, and it was on the main news showing our clinic, an Azeri dentist who's treating the Azeris, and they are pretending that they're helping their population. So they use our clinic and think they say, oh, look what we're doing for you people. That's it. Anyway, so, and that was 2020, and then 2023, obviously, we lost Artsakh, and we lost everything. So our 6 clinics were gone, and we couldn't even move our mobile clinics because they restrict us. There couldn't be anything in there. And at that time, we just lost there. But then we decided to have to go to the next step.
Orthodontics in children is one of the most important specialties in dentistry, focusing on prevention and treatment of malocclusion, which can lead to many other oral diseases. I would like to introduce board member, come up here, Alex, Dr. Alex Bejan. Has been part of our team since 1994. After his first trip with us to Arzach, Alex insisted that we must incorporate orthodontics into our clinics. He personally carried every piece of equipment needed, including some very heavy laboratory machinery, from Needham all the way to Shushi. He spent a lot of time training our dentists in orthodontics and followed up with them over Zoom with the patients that they were treating. Space maintenance due to early tooth loss is one of the important projects that we had that can lead to further problems. Where are you going, Alex? So one of the first ortho patients that we treated in our clinic was Anna Sahakian. Anna is the daughter of the very first dentist that we hired in Shushi, Dr. Manuel Sahakian, who sadly we lost to a tragic accident. Anna, with her healthy and beautiful smile, studied at the UWC in Dilijan, which is a world-renowned school with international students from 80 different countries. He was awarded a full scholarship to Cornell University, and this past year, she was handpicked for a prestigious software engineering program at the Microsoft Corporation. We are all so very proud of Anna, and thank you, Alex. Last but not least, I would like to introduce Dr. Arnold Weiss, currently the co-president of our foundation. 18 years ago, Burge convinced Arnie, a world-renowned pediatric dentist from Brookline, to join us to a trip to Armenia. He instantly fell in love with our country and changed his name to Weissian. Since then, he has become an invaluable part of our mission, teaching our dentists not only clinical skills, but behavior management techniques, all without speaking a word of Armenian. His dedication is truly unmatched. Just in the past year, he has traveled independently to Armenia 4 separate times, to ensure that our newest dentists received the highest training and would be able to provide state-of-the-art care to our patients. Thank you. Dr. Arnold.
So thank you very much for coming. Glad to be here. This is very important to me, this organization and the country. I really do feel part of the country, and I do feel it's my second home. So going along in our history, in 2003, we had a fundraising event in Lyon, France, with UMAF and the Rotary, and that way we raised money to fund our first mobile clinic. These are some of the people, the UMAF, Rotary, and region. And right here, the Alan Kay and Isabel de Kazarian Foundation in the Boston area were able to fund our first mobile clinic. In 2025, we had the launch of our mobile in Yerevan, and we had the Minister of Health there and the French ambassador to Armenia there also, sorry. In any case, we had a nice event there. We had a lot of the other NGOs, a number of dignitaries there for our initial opening. And this is what we have. We have our Adomnibus, our mobile clinic, our tooth bus. So that was launched this last February. I came February, came now. It was 2 times before that to get things going. And we started our mobile there. And basically our objectives is to have 0 children to have caries by age 15. And now it's a tremendous amount of decay that we have in the country, as Dr. Kalajan had mentioned. We want to bring oral health as a top national priority, and is not a priority at all among the organizations are the government and among the people and even a lot of physicians. We have collaboration with the government. We're trying to get the private sector, NGOs, people together in this effort to improve the dental health of the communities and also the diaspora. Basically, our foundation is on 5 points. Academy, that's the education. This last 2 or 3 months, I've given 5 lectures to pediatricians, to pediatric medical residencies, to community health care workers, etc. And just getting the awareness out so that they can look at care and start younger. At school age, we see them at the schools right now, but the truth is that by the time they go to the school, there's a lot of decay already. And what we're trying to do is get them to evaluate their children and refer them early and do preventive education. Prevention is very important to teach not only the children, but the parents, the school people, the nurses, the physicians and the people in the community about oral health, and that dental disease is 100% preventable if you do the proper precautions. The middle is the care for the children that we're doing the omnibus, going to the schools in all the different villages and taking care of the children, doing complete examinations, chartings, doing the preventive work, and doing any dental care that they need before we leave that school. The research component is basically there is very little history, statistics about oral health in Armenia. And what we're doing, we have a dental software that we're taking and we're charting everything, getting statistics in many different areas, so we can go ahead and take that and go to the government, to go to the ministry about what the issue is with oral health in the country. And we're taking the software and we're going to try to make it available to the NGOs and other people in the country so that if everyone is doing the charting and examinations the same way, we can go ahead and take that data, not only from the 150 people at this school, 150 people in that school, but take it and put it all together so we can go to the government and say, this is a problem of thousands of children and we need to do something about it. The research is that component there, and advocacy, really going out there and doing something to change the whole history of dentistry in the country, to make sure that the government, the physicians, everyone understands what the problem is, and making sure we get a coalition. Right now, we're working on a preventive program to recommend to the government with a number of other groups, and this is something that if we go together, we're going to be able to make a difference in the country. So, again, we're rooted in innovation. The omnibus is a very, very completely modern facility with x-rays, with panoramic, actually digital x-rays, all the proper equipment that you would have in a regular office here in the U.S. The electronic data system, very important. Again, that's going to give us the data. It not only helps us with treatment planning and for treatment to the children, but also it gives information that we can give to the government. Japitor, again, we talked about that. We tried to get a number of people together. We ourselves in the Syunik area, in the Goris area, did have that Jupiter Day so that we could go ahead and give dental awareness to the community. And other things that we're working on, a little bit of telemedicine, AI, getting a national database for dentistry, and getting together this National Oral Health Council. We have 3 groups already that have agreed to work together with us, and we're going to try to get more so we can use our joined efforts. When I talk about the dental software, and you may not understand, but we take, and it's basically a basic charting of all the teeth. We put all the charting there, the decay, what restorations, what needs to be extracted, etc. And then on the other side, we put together a treatment plan. A treatment plan where sequenced treatment, so the patient comes in, doctor looks at the record, there's 2 teeth here, 2 teeth here, 2 teeth here, and the visit is finished. To make sure we have all information together. The goals that we have for Adomnibus, basically, we're doing it right now, free dental care to the village of Sunik in that area. Right now, we're outside of Goris, and our next step is probably one of the small villages on the border of Azerbaijan. And we're trying to give the highest level of care that they can have in Armenia. It's really a comprehensive school-based oral health program, trying to get the teachers and everyone involved, so when we leave, they have tools so they can go ahead and repeat it even when we're not there, and to make sure every child, every year, gets some kind of communication about oral health. Educate everyone about the importance of preventive dentistry. Talked about that as far as all the different groups that we're trying to work with and leave the city with, and change the face of dentistry in rural Armenia. Again, provide free dental care for all the children, from basic screening to complete dental care and education. Our executive board, 5 of us are from here. Executive board is basically Los Angeles, Boston, Toronto, Lyon, France, and Yerevan, and São Paulo, Brazil. So we have 6 different locations that we have executive board members working together.
Dear guests, thank you very much for being with us tonight. I'm Dr. Viken Ohanessian. I'm a board member of OHFAR Foundation since last year in 2025. I'm a medical doctor specialized in public health. I was born, raised in Lyon, France, where my family and grandparents lived and settled after the genocide. And I'm speaking with you tonight from Yerevan, where I live now since 2022. I moved to Yerevan from France in 2022 after the war, and I decided I made that decision to build our country, to improve our nation, and to contribute to the health system improvement in Armenia directly from the ground. And I invite all of you to come to Armenia and move to Armenia, because this is the best thing that you can do for your country. However, I'm sure that many of you cannot or will not, and we will be very pleased if you could support our country and our children by supporting OHFAR.
So that's, and Viken has been one of the powers as organization. Public health has helped us considerably in developing our goals and our vision. Our team, Hrisme Kachayan, she's a pediatric dentist, one of the very, very few that are in this unique region. Ani is our nurse, our dental assistant, and Armine Arkelian, she's the accountant who has helped us with all these difficulties going through with the government getting our license and getting things together. And you may know or may not know how difficult and how many hoops you have to go through to accomplish things in the government. But thank God we are doing well, we have done it well, and moving along. And that's one of the things, we put our license, it took us 9 months to get this license, which should have taken a month or 2 or 3. But again, we have it and we're functioning now and everything's going well. This past February 4th, when I was there, we had the launch of the Adomnibus program in the Akna village. And these are some of the people from the mayor from Gores, the governor from Kapan, coming and visiting the omnibus and signing our MOUs with them for working with the government. Here's our very first patient in Sunit that we treated there. Wonderful children. I find that they're really very respectful, and I find the kids very nice. That's one of the reasons I really enjoy going there and caring for them. Here's the winter time. It was cold, and we had to thaw out the bus a couple of times with the water system. We learned to drain it every day, so it wasn't. We didn't lose a day of work there. But there's just some of the kids in the office, into the clinic with our panoramic X-ray and the staff there. This is the Jupiter Day that Aram had mentioned. And this is just a quick tour of the mobile clinic and how it looks. Welcome everyone to Adamadus from OHFAR. I'm glad to show you what we have here. Our seating area are on deck for our patients and consultations with the staff. We have our computer system. We have our iPads, which shows what we do all our charting from, etc. We have over here, we have our autoclave and water distiller, and on the other side here we have our ultrasonic, our cleaning area, our dental unit, state-of-the-art dental unit with dental unit, nice chair, and here we have our panoramic area. Panoramic, to take panoramics for all the children. It's one of very few, if not the only two maybe in the Sunit area. And here we have just our area where we have our computer, our digital camera, and storage area for instruments. Here you have a better view of our chair, delivery system, suction system, and this is our mobile. And I'll just let you out so that you don't have to stay in here. Thank you so much for watching us. I'm very proud of what we have there in our clinic and our staff and what we're doing there. This is the director of the school.
Ես ակների միջնակարգ դպրոցի տնօրեն Էլայդա Մաշուրյանն եմ։ Փետրվար ամսին մեր դպրոցի բակում ժամանեց մի գեղեցիկ ավտոբուս։ Սա սովորական ավտոբուս չէր, այլ ատամնաբուս էր, որը ժամանեց այստեղ հայ-ֆրանսիական OHFAR ընկերության կողմից մեր աշակերտների բարի ժպիտ առողջ ատամներ պարգևելու համար։ Շնորհակալ ենք OHFAR ընկերությանը, հայ-ֆրանսիական ընկերությանը, առ այն, որ իրենց գործունեությունը սկսեցին հենց Սյունիքի մարզի այս փոքրիկ բնակավայրում։ Ավտոբուսը հագեցած էր կատարյալ թիմով, գերժամանակակից տեխնիկայով և սարքավորումներով, և կարողացան բավականին մեծ օգնություն ցույց տալ ակների միջնակարգ դպրոցի աշակերտներին, ընդ որում առաջինից մինչև 12-րդ դասարանցիներին։ Բոլոր աշակերտները ներգրավեցին հետազոտության մեջ, բոլորի ատամների համար բոլոր փուլերը անցկացվեց, ատամնաբուժական բոլոր փուլերը իրականացվեց հետազոտումից մինչև բուժում, որը շարունակվում է մինչև այսօր։ Եվ մինչև վերջին երեխայի բուժումը թիմը որոշել է իր օգնությունը ցուցաբերել, այնուհետև տեղաշարժել ավտոբուսը մի այլ բնակավայր։ Շնորհակալություն բոլոր կազմակերպիչներին, հիմնադրամի բոլոր անդամներին, ովքեր իրենց մի փոքր լուման ու ներդրումն ունեն այս ազգանվեր գործում։ Սա հայրենասիրական մեծ գործ է, համայնքի բոլոր երեխաների ատամները առողջ են, նրանք ունեն բարի ժպիտ, իրազեկված են, բերանի խոռոչի մասին բավականին ինֆորմացիա և տեղեկություններ իմացան և ստացան նվերներ OHFAR ընկերության կողմից, խոզանակ և ատամի մածուկ։ Շնորհակալություն բոլորին, թող շարունակական լինի այս ազգանվեր գործը։
And this is just.
Hello, I am Dr. Ripsime. I am pediatric dentist. I working in OHFAR. Now we are in Sunik, in village Akner.
Բարեձիս, ես Ամին եմ, աշխատում եմ ատամնաբույսում որպես բուժքույր, շատ ուրախ եմ, որ այս պահին գտնվում ենք Սյունիքում, Ակների դպրոցում եւ սիրում եմ աշխատել երեխաների հետ, որ ունենան առողջ ատամներ ու գեղեցիկ ժպիտ։
I like my work, I like children, I like Sunik and Akner, but if you can help us, we can after Akner go another village and help another people, another children in Sunik, because in Sunik we have more problems with children dentistry, and we don't have pediatric dentists and clinics. And if you can help us, we will be happy, and children will have more smile.
So that's our wonderful staff there, and in this school we've seen 127 children, more than 90%, I think it's not 97, but percent have caries. There were 450 fillings needed, 40 extractions, 76% need 3 or more visits, and at the time that we put this together, there were about 35% of the children were treated. So just something that I really love doing. I'm committed to this. Like I said, I've been doing it for 18 years, and the children, the people appreciate it. And the next village we go to is a little further out, and there is no dentist within probably an hour or so, or an hour and a half from there. And we hope to be able to treat them and go to some of the nursery schools to see the really young children. And I thank you.
Ladies and gentlemen, thank you again for being with us tonight. You can see our website. We are on LinkedIn, Facebook, Instagram. Please follow us.